And with that, Mr. President, I would like to move to another subject. Mr. President, the political world this week has been focused on the United States Supreme Court and the arguments that have taken place over there with respect to what has been referred to as Obamacare. Now, I rise today to discuss how the 2-year-old health care law is forcing more government intrusion into the lives of Americans. After all, what could be more intrusive than the federal government telling you the type of health coverage you must purchase? Purchase this product or face a penalty. With this law, I believe the American people have recognized that Congress has exceeded its constitutional authority. This week, a poll conducted by The Hill found that 49% of likely voters believe that the Supreme Court will rule against the constitutionality of the health care law, while only 29% believe it will be upheld. The American people have to ask themselves whether we should be able to punish citizens based upon whether or not they purchase a product from the private sector. The Commerce Clause only allows the federal government to regulate existing activity that affects interstate commerce. I hope this distinction will be recognized by our justices on the Supreme Court. With no end in sight to escalating health care costs, Republicans want to see innovation within the private sector to bring about changes to our health care system. Today, Medicare and Medicaid are running up our national debt and bankrupting our state. One would think less government involvement, not more, would help bring health care costs under control. Instead, the health care law builds on this administration's desire to have the federal government control Americans' health care decisions. To this end, the current administration has created 159 new boards, bureaucracies, and programs under the health care law called Obamacare. As of this month, the administration has released more than 12,000 pages of regulations related to the law. The Secretary of Health and Human Services will have the power to make more than 1,700 rulings affecting Americans and the health care they seek. Time and again, my colleagues and I have warned that adding more red tape and bureaucratic oversight that will affect the relationship between a doctor and a patient is not the prescription that Americans are looking for. We want to protect the relationship between the patient and the physician. Consultation between the patient and the physician should be the determining factor in what procedures that patient chooses, not someone who sits on a panel in Washington, D.C. However, this may well be the case, as the health care law concentrates power in the U.S. Preventive Services Task Force. This is the same task force that in November 2009 recommended that women between the ages of 40 and 49 no longer obtain annual mammograms. These are the types of recommendations that Washington bureaucrats could make in the future. And I especially understand the importance of early detection of cancer, having been there myself, and will fight to see that individuals, through the recommendations of their doctors, are in charge of determining their own health care procedures. Throughout the debate 2 years ago, we constantly heard from folks on the other side of the aisle that if you liked your health care coverage, you could keep it. Well, guess what? According to the latest CBO estimates, you can ask 5 million people who will see their employer-sponsored health insurance end in 2016, whether they had the opportunity to keep what they like or not. Further, the incentives for employers to drop their coverage and move employees onto a taxpayer-subsidized plan means that we could see up to 35 million Americans lose their current coverage over the first 10 years of implementation of this law. Washington is now in the business of reducing the flexibility of consumer-driven health care policies like health savings accounts and flexible spending arrangements. Congress created health savings accounts to allow health care consumers who wish to participate in the program more control over their own money and how they choose to spend that money for health care services. Now, contributions to these arrangements will be limited to $2,500 per year, and over-the-counter medications will require a prescription if they are purchased within these tax-free dollars. This is already leading to doctors having to fill out more paperwork so that an individual can walk into a drugstore to purchase aspirin or a cold medicine. Yet again, this is just another glaring example of bureaucratic meddling in the lives of American consumers. Small businesses are also feeling the intrusive effects of Obamacare. In the most recent survey of small businesses by the U.S. Chamber of Commerce, an astounding 74% of small business owners surveyed said that the health care law makes it harder for the businesses to hire more employees. Think about that for a moment. 3 out of 4 small business owners are having difficulty hiring because of the uncertainty of health care costs. Finally, our states are also feeling the heavy hand of more government control. The Medicaid expansion that begins in 2014 will make it increasingly difficult for state leaders to balance their budgets due to strict maintenance of effort requirements. These requirements prevent states from designing health care programs specifically tailored for their own citizens. Medicaid currently consumes about 1/4 of state budgets, and Obamacare creates the largest expansion of the program since its inception. Through 2023, the cost to states is now estimated to be an additional $118 billion. In my home state of Georgia, the expansion will cost the state about $2.5 billion through 2020. Money in the budget to pay for this expansion will come at the expense of higher education, transportation, and law enforcement services. Nationally, 24.7 million people who will be added to the Medicaid rolls will be entering a broken system where patients are denied access to about 40% of physicians because reimbursement rates do not keep up with medical costs. 2 years ago, the legislative process that unfolded before us was not something that any senator should be proud of today. Backroom deal-making and forcing legislation through under a subversive process left the American people angry and upset with Congress. If you don't understand that, folks, just look at the approval rating of Congress today, and this played a major role in that approval rating. I hope in the future that we'll have an opportunity to revisit the issue because our system does need reforming, but it needs to be done in the right way, and it needs to be done in a very transparent way. And I hope that we can come up with solutions that are actually supported by the American public, not solutions that make the American public angry. Mr. President,
I yield the floor. The senator from Mississippi.
Ask unanimous consent to speak as if in morning business.